Let's grab our foam roller and make our way over to the wall. We're going to begin with an anterior delt and psoas stretch, starting with your dominant leg down on the roller, other leg forward in a kneeling psoas stretch. The same arm as our back leg is going to come up into a V position with the outer edge of your thumb on the wall as well as the wrist. High V with the shoulder down the back. You're inhaling laterally into the rib cage, pulling the navel in towards the spine as if you're putting on a tight pair of jeans, and lifting in and up on those muscles that stop your stream of pee. Fog a mirror as you twist away from that arm on the wall. Again, inhaling laterally, pulling the belly in towards the spine, lifting in and up on those muscles that stop your stream of pee. Hear the breath like Darth Vader as you twist the torso away from the arm. Let that front knee track forward over the second and third metatarsals. Keep driving that back knee down into the roller. Take another exhale and make your way to the other side, setting up. We're opening up two posturally tight areas before we begin level 3 trampoline cardio for people with kyphotic lordotic or lordosis posture. This is an excellent way to prepare for jump rope work if you have any desire to jump rope, but it's also a fantastic way to work on your endurance, and it's completely low impact. You're on the trampoline so the joints aren't feeling the pressure they would feel jumping on a hard surface. As you're breathing here, I'd encourage you to think about driving that back knee down into the roller so you can get all 5 of the metatarsals, all toes of the back foot down on the floor, opening up the foot as well. Take another breath here and make your way up to stand. We'll get our trampoline set up and we're going to begin learning our 3 exercises. Make sure you're doing these 3 exercises at no more than 50% effort. 25 to 50% effort to learn them, and then we'll go all out once we begin our bursting. We're in level 3 now, so we'll have 45-second recoveries between our 1-minute bursts. We'll begin by learning our exercise in the transverse plane. I'd like you to grab your second to lightest Theraband, and you'll need your third to heaviest loop band around your outer thighs. We'll keep this loop band around the outer thighs for the duration of our work. The band, the second to lightest band, we're going to make a serratus anterior position. Now, holding this position only when we're doing our turning component. We'll let the knuckles face in towards one another with the elbows still lifted, but no pull out on the band as we do our 4 bounces. These are our setups on both feet, and then we switch to our dominant leg, pulling out for that serratus anterior isometric hold, 4 center, 4 turning, and then 4 back to center. Then the knuckles come in to face one another. We do our 4 on 2 legs to reset, and then we begin our 4 on 1 leg, 4 to turn, and 4 to turn back. I like to do my first 3 on 2 legs with the knuckles facing in, pull out on the band on my last one on my double leg, and then begin the single leg, because I find sometimes pulling out on the band as I shift to 1 leg can be a little jolting. So play around with that. Feel free to count 1, 2, 3, then pull out on the band and then shift to the 1 leg, or to do all 4 with that band slackened and shift as you shift the legs, whichever you'd prefer. This is our first exercise in the transverse plane. We're going to set down that second to lightest Theraband, and we're going to grab our third to heaviest Theraband, placing it behind the shoulder blades. This is here to remind you to bring your chest back towards the band, closing the rib cage. Palms are facing up, soft micro bend in the elbows. We'll keep the arms extended for the whole time for this exercise. Working in the sagittal plane, moving forward and back. We'll begin with both legs right in the center for 4, 3, 2, 1. Then we'll shift to 1 leg. And we'll go forward for 4 and back. So forward and back for 4, 3, 2, 1. Back to 2 legs for 4, 3, 2, 1. Back to the non-dominant leg, traveling forward and back for 4, 3, 2, 1. Let's repeat this pattern one more time to reinforce it. Remember, we're only working at 50% effort right now. Range of motion, as far as jumping, is not important. It's about the quality of the movement, maintaining your checkpoints. So that are soft knees, that includes soft knees that are tracking over your second and third metatarsals, a neutral pelvis or a little tuck of the pelvis if you have no back issues. Working in flexion can allow you to really turn off the quads and hip flexors and access the back chain of the legs and the abs. Shoulders down the back, collarbone wide. Apple distance between the chin and the chest. Focus of the eyes up eye level. Make sure that that chest is reaching for the band behind the shoulder blades and the belly is pulling in towards the spine. Let's set this third to heaviest Theraband down. We're now going to need to grab the first Theraband we were working with, the second to lightest, and we're going to do a T-pull here. Same thing with our serratus pull. You can let the knuckles face in during your reset, during your double leg bouncing, and then you can pull out on the fourth one so that you can begin the single leg work with the resistance of the upper body. So we're doing 4 center, and then we're doing 4 side to side with a pull out on the band, back to 4 center without pulling out on the band. I like to pull out on the 4th count and then begin the 4 side to side on my non-dominant leg. So we're alternating that back and forth, 4 center, 4 on the dominant leg, 4 center, 4 on the non-dominant leg. Keeping that going for a solid minute once we begin. Let's do another 20 seconds here just to reinforce this final exercise, traveling side to side in the frontal plane. Remember, don't make the range of motion a priority. Make the quality of the movement. You want to keep the legs hip distance apart and keep a soft micro bend in the knees. This is going to keep those knees safe and allow you to access your hamstrings and glutes, the underactive areas of the back chain of your legs. Okay, I'm going to remind you of the first exercise in the transverse plane. We had our serratus hold when we did our turning. 4 on our dominant leg, 4 to turn, 4 to turn back to the knuckles facing one another for our reset for 4, and then repeating on our non-dominant leg. I'm going to count you in. Remember, quality versus quantity. If the arms get too tired, let go of that band and focus. Just hold the arms up and focus on the lower body. Here we go. 3, 2, 1. We've got a full minute here. In the transverse plane, first set, you're giving it all you got. Remember, those elbows in the serratus anterior hold are as high as the shoulders. You're creating 2 right angles. The wrists are flat. The palms are facing down. The knuckles are facing up. The focus of the eyes is eye level or a little higher. There's an apple distance between the chin and the chest. You can roll those shoulders down the back. Collarbone is wide. Hear those exhales as you're breathing. Inhaling laterally like an opera singer, pulling the belly in towards the spine, keeping the range of motion small when you turn. You can take all 4 jumps to turn. If you're feeling so inspired, you can take 2 to turn. Whatever your body is feeling today, be where you are, keeping a soft bend in the knees, counting you down 3, 2, 1. Remember what side you stopped on so that you can pick up on that side when we begin again, evening out the work we're doing today. So we've got a 45-second recovery before we repeat this exercise in the transverse plane. I'd like to encourage you to take any stretches you feel you need. I'll give you ample time. I'll give you a 20-second notice before we begin, and here we are, 20-second notice. So if you need to set up with the band, if you've taken them off, go ahead and do so. I'm going to keep you posted so that you're ready to go. We've got 8 seconds. Make sure you're set up. There's a soft bend in the knees. You're preparing mentally, counting you in 3, 2, 1. Second set here in the transverse plane. Level 3 trampoline work for KLP and LP. This is an excellent way to exercise your lymphatic system. This is the top form of exercise for people with cancer. It really, really helps the lymphatic system. So if you do have any friends or family suffering from cancer, please refer them to YouniquelyFit. We want to be there to help and to give them something to do from home as they battle what they're battling. You're doing excellent work. You're almost there. 20 seconds to go. Focus on that form. Soft bend in the knees. Remember, the turning plane is the most challenging. It's where 90% of injuries occur. So we really want to work on stabilizing, making sure that that knee is tracking over the second and third metatarsals. Our focus of our eyes is not dropped forward. Our head is on our spine with an apple distance between the chin and the chest. Counting down 3, 2, 1. Take your break. As you're taking your break, I want to remind you of our exercise in the sagittal plane. We need our third to heaviest Theraband behind our shoulder blades. Serve the platter arms. Once you've set up, you have your 4 bounces center with both legs. And then you switch to your dominant leg going forward and back. And then back to 4 on both legs center and 4 on the non-dominant leg going forward and back. As you're doing this, keep the legs hip distance apart, a soft micro bend in the knees. I'm going to pause here. You are at the 20-second mark before we're going to begin, so make sure you're getting set up. I'm going to count you in. You're doing excellent work today. Counting you in 5, 4, 3, 2, 1. First set here in our sagittal plane going forward and back. Make sure you're focusing on the quality of the movement, not the range of the motion. Keep the eyes up. Focus up. You don't want to throw your focus down. That's going to take your head forward on your spine, causing neck issues. Roll those shoulders back, wide collarbone. Imagine that chest moving through the body all the way to the shoulder blades, closing the rib cage. Belly pulls in towards the spine. You're keeping a nice bend in the knees. Hear your breath. Just 20 seconds to go. Give it all you got. Working on that posture. Engaging the upper back, engaging the abs, the internal obliques, the transverse abdominis, those glutes and hamstrings. Almost there. Counting you down. 5, 4, 3, 2, 1. Take your break. I'll let you know when you have 20 seconds before we begin our second set in the sagittal plane. Make sure as you're working today that you're drinking a lot of water. Remember, it's 8 ounces is a glass and 8 glasses is the daily recommended amount. For every cup of caffeine and alcohol you have, you want to add an additional cup. So I'm typically drinking 10 cups of water a day if I have a cup of coffee and I have a glass of wine in the evening. Some people say you need 2 glasses for every cup of caffeine and alcohol. It's kind of, there's a lot of literature out there saying 2 and 1. I usually do 1 per glass of alcohol and caffeine. Okay, you've got 20 seconds. Get yourself set up. We're going to do our second set here. I'm going to count you in 5, 4, 3, 2, 1. Second set in the sagittal plane, 100% effort. Focusing on the quality of the movement as we go forward and back, working on our knee traction, keeping the knees soft, keeping the legs hip distance apart, the shoulders on the back, the chest reaching for that band behind the shoulder blades. Really working on our posture here, keeping our focus up eye level, apple distance between the chin and the chest, not focusing on the height of the jump, but on really getting into the backs of the legs, the glutes, the hamstrings. We can do this by keeping those knees soft and the legs hip distance apart. Excellent work. Doing great. Push yourself. 5 more seconds. 4, 3, 2, 1. Take your break. As you're taking your break, I'm going to remind you of our final exercise in the frontal plane, going side to side. You have that second to lightest Theraband, and you're going to do the same thing you did with the serratus. So in the center, the knuckles face in and we're not pulling out on the band. And as we do our single leg work, we pull out on the band. So we have 4 center with the knuckles facing in. We pull out on the 4th count and then switch to our dominant leg to go side to side for 4 and back to center for 4 and to the non-dominant leg, side to side for 4 and back to center for 4. I'm going to take a little pause. I'm going to let you get set up. Once you're set up, I'm going to count you in 5, 4, 3, 2, 1. 100% effort here. Give it all you got. Cardio bursting is about pushing yourself, but also staying strong in your form. So check out your form from the bottom up. We're pressing into the outer edges of the feet to combat the pronation that's so prevalent with our skeletal structure. So baby toes, outer edges of the feet, very active. We're keeping the knees soft and tracking over the 2nd and 3rd metatarsals. And as we go side to side, we're keeping the legs hip distance apart. We're working either with a neutral pelvis, that's a position between a scared puppy dog tuck and an arch of the back, or we're working with a little tuck if we're feeling recruitment in the front of the thighs, those quads and hip flexors. We want to turn them off. Our abs are pulled in towards our spine, our chest is reaching for the shoulder blades, closing the rib cage, shoulders down the back, apple distance between the chest, counting you down. 3, 2, 1, take your break. Final break before our final burst in our frontal plane here. You've done excellent work today. I'd like to encourage you, if you haven't logged in for flexibility, to take that extra 12 to 20 minutes to work on your flexibility. We have 2 excellent options. One is programmed for anybody that has back or knee issues, and it's going to be a safer variation. The other is for anybody, but is not recommended for people with back or knee issues. Okay, I'd like you to get set up. We have 15 seconds before I'm going to count you in. Make sure you're ready to go. Bands all ready. Counting you in. 5, 4, 3, 2, 1. Give me 100% effort. All you got here. Really push yourself. You've got this. You can do this. Give it all you got. You're almost there. Side to side is tricky. If you're feeling the knees, make sure the outer edges of the feet are really active. Push into the outer edges of those feet. Keep the knees soft, tracking over the 2nd and 3rd metatarsals. Hear your breath. Make sure you inhale through your nose and exhale out the mouth. Again, inhale through the nose and exhale out the mouth. Keep that chest reaching for the shoulder blades. Keep the focus up eye level. Apple distance between the chin and the chest. Belly pulling in towards the spine. Collarbone wide. Those knees are softly bent, counting you down. 5, 4, 3, 2, 1. Great job. We're going to move into flexibility work. Coming over to the wall, into a wall pec major stretch. Stretching your dominant arm out into a T, keeping a soft bend in the elbow as to not pull on the ligaments, but stretch the muscles. We'll twist away, retract our chin here, exhaling the air out. Again, inhale laterally, brace the abs, retract the chin, exhale, and twisting a little deeper. Again, inhale, brace the abs, retract the chin, exhale to twist. Doing great work. Inhale, prepare, brace the abs, exhale, twist. Move your arm into a W or V position. If you took the full class, do the variation you did not do against the wall or on the floor, lying supine on the roller. And we're still twisting away from the arm, retracting our chin to engage our neck flexors. Knees are soft, twisting. One more breath here. And let's move to the other side for our pec major stretch with the arm stretched in a T, soft bend in the elbow. As you twist away with the legs together or hip distance apart if you have back issues, retract your chin. So it moves back and you tuck it under on each exhale as you twist deeper. Inhale laterally, pull the belly in towards the spine, lift up on the muscles that stop your stream of pee, fog a mirror. Hear your exhale like you're fogging a mirror like Darth Vader as you twist. Inhale into the side body, brace the abs. Exhale to twist, moving the arm into a V or W position on the wall, changing the stretch to either the pec minor if it's in the W or the anterior delta bicep if it's in the V. And same thing, retract the chin as you twist, opening up the back of the neck, side of the neck, recruiting the front of the neck, soft bend in the elbow if you're in the V position as you twist. We're going to now turn and face the wall, feet hip distance apart. Step your dominant leg back first. Deep bend in the front knee, tracking over the second and third metatarsal. Pull the abs in, neutral pelvis, focus up eye level. Driving that back heel down as the pelvis pulls forward. Abs engaged, holding it here. Inhale and exhale, step that leg forward, stepping the opposite leg back. Nice and parallel with that leg. Deep bend in the front knee, tracking over the second and third metatarsal. Reach the chest back towards the shoulder blades. Retract your chin. Keep your focus up eye level. Drive the heel down as the pelvis drives forward. Inhale. Brace the abs. Hear your exhales. We're releasing the gastrocnemius on each side. That outer calf muscle. One more breath. Exhale. Let's go ahead and grab a chair. We're going to set up for a supported lunge chair, hip flexor, psoas stretch. Start with your dominant leg behind you. This will be the harder side. Front foot should be completely grounded on the floor, outer and inner edge. So if it's hanging, dangling in the air, put a block under it or a book. And then from here, take the outside arm up, squeezing the quadricep of the back leg, trying to straighten it. Notice all 5 metatarsals are down. You don't have the whole foot down or the out or the heel or arch, just the toes. And we're side bending away. Try to relax the chest back towards the shoulder blades. Plug the shoulders down the back. Keep your chin retracted here. This is a deep, deep stretch. Very challenging postural stretch. I'd encourage you to be here for a full minute. This is going to really change your movement patterns once we open up those overactive hip flexors, allowing you access to your core to flatten your stomach and deepening the work in your butt muscles and hamstrings to give you longer legs and a tighter tush. All right, you're doing great. Inhale laterally. Watch out for the ribs spraying forward. Pull the belly in. Exhale to side bend deeper, squeezing the front of the thigh. Equal weight in both feet, or metatarsals rather. Go ahead and exhale to switch sides, setting up on your second side. Make sure that front foot's fully connected. So are the back metatarsals. Outside arm is up, shoulders are down, chin is retracted. You're going into lateral flexion towards your chair. Watch out for overextending the low back. Just keep the belly in towards the spine and lift up on those muscles that stop your stream of pee. This is going to help tremendously with the back issues, if you have them, by conditioning your transverse abdominis. As you inhale, hear those exhales like Darth Vader. What's happening in your rib cage? Reach the chest back towards the shoulder blades. Make sure that front knee is tracking over the second and third metatarsal. The toes beside the big toe. We consider the big toe the first metatarsal. All right, from here we're going to slowly come out of that. Set the chair to the side, coming back to center. Take a hold of your roller, and you're going to stand in a lunge, putting your back knee down to come down safely. If you have back issues, brace your abs. We're going to roll out our quadriceps, bring our forearms onto the ground, and walking forward and back, keeping the abs tight, neutral pelvis, getting deep into the fascia of the quads. You can play around with external rotation of the legs and parallel legs, finding any spot that needs your attention and holding it there. The quadriceps are an overactive posturally tight area, so we're going to be here for a full minute. Feel free to just hold the position and really put your body weight and pressure into it if there's a spot that needs attention. You can roll back and forth, engaging the abs, working the back as you walk in this plank. If you're not finding spots, I'd encourage you to externally rotate the legs, getting deeper into the groin area where the hip flexors are. That's definitely going to be tight if you have lordosis or kyphotic lordotic posture. One more breath here. Inhale laterally, pull the abs in, lift up on those muscles that stop your stream of pee. Exhale, sustain that lift. Coming off the roller, we're going to now bring our dominant leg. We're going to roll our posterior tibialis, which is medially near the knee, down the tibia bone. You can stay up by the knee, that's usually the sweet spot, or you can roll about halfway down along the tibia bone into that fascia. You can always lift the hips up, pressing into the other leg or into your arm, however you leverage it, to intensify the stretch or the release of the fascia. Do what feels best for you. This is an intense exercise for people that have knee tracking issues. Any alignment issues can cause, especially the pronation. So as you're doing, your sumo squats and lunges, and learning to track the knee over the second and third metatarsal, if the knee tracks poorly, not rolling this out can result in knee discomfort. So we really do want to think about the posterior tibialis and the other spot we're going to get in a second as areas to reset our knees when we are learning better movement patterns and conditioning the weak muscles in our body. So before we go to the other side, we're going to take the roller now above the knee immediately. This is a great area to get into because it releases the femur bone back down. So anytime you do cardio or even walking, no matter how high or low impact it is, especially if it's high impact, if you're jumping, you want to reset your femur bone so it's not hiked up and pulling on the back. So as you roll in, I encourage you to play around with internal, external, internal, parallel positioning of that inner thigh area right near the knee to get that sweet spot to release the femur bone down. You can always intensify it by pressing heavier into the roller. And once you've had one more breath, we're going to slowly make our way to the posterior tibialis rolling on the other side. Remembering that's medially along the tibia bone. I find that the sweet spot's near my knee. Play around with the rotation of the leg. If it's internally or externally rotated, wherever you feel more tenderness, that's where you want to be. Push yourself to really stay for this full minute. This is going to really change your range of motion and your movement patterns. It's the combination of strength training, cardio training, and flexibility and balance work that's going to allow you better functional movement and enhance sports performance, as well as prevent injuries. So as you're working here, be mindful of holding the breath. When things hurt, we hold our breath, but try to not do that. Send oxygen to these muscles, allowing them to relax and release. Brace your abs. We're going to reset the position above the knee now immediately, getting into our posterior tibialis. As you're rolling above that knee, play around with the positioning. I often find people really, the first couple times they do this, have trouble finding the tender spot. So encourage yourself to explore movement in the leg from the hip socket, internal, external, right by the knee, getting into that fascia. It's really important if you have back issues that you release this area and reset the femur bone so it's not pulling on your low back. Couple more breaths, keeping the chest reaching for the back body, trying not to collapse into the side of the body or the arm that's down, keeping your chin retracted, using the front of the neck. Last breath, brace the abs. From here, we're going to come slowly over to the wall, bringing our legs up the wall. With the legs up the wall, I want you to find a neutral pelvis if you have back issues and tuck the pelvis if you don't. Subtle external rotation to open the legs out to the side with relaxed feet. Once the legs are open, let's externally rotate from the ankle joint, doing circles with our right foot for 10 and 9, away from the body, 8, 7, 6, 5, 4, 3, 2, 1, and reverse the circles. Actually, no, let's do the same circles, eversion, away from the body on the other side for 10, 9, 8, 7. As you're doing them, try to imprint the back ribs, retract your chin. Check in with your pelvis. Is it in the proper position? Neutral if you have back issues, tucked if you don't. Finish your last circle. Slowly bring the legs together and make your way off the wall, coming into a comfortable seated position, using the abs to sit up tall, pulling them in towards the spine. Great work.